That time on duty, this very unusual thought had flashed through my mind for no known reason. I decided to check it out straight away. At the time, I had a headache, a pain in the heart, and a pain in the right kidney. I started decreasing my breath. In other words, I had instantaneously invented my method of normalisation of breathing. Practically a minute later, my headache disappeared, as did the pains in the heart and the kidney. I decided to recheck. Is it really so? Is there such a close connection? Am I right or am I mistaken? Right there and then, I invented the way of testing it. That is, the deep breathing test. Now, what do you think happened? I developed the pain in the heart. Well, just 2 breath-ins, and the attack is starting. That's enough. Are you dizzy? Are there any spasms in your chest? Yes. If I listen to your chest now, I would hear wheezing. So you see, you've made 4 deep breaths, and the disease is now in evidence. And this is what is recommended and taught by the medicine. The whole world is being taught this. Well, I understand very clearly. This is how it works. Not only the hypertension, but the stenocardia, and the ischemic heart disease, heart attacks, strokes, enteritis, Raynaud's disease, and so on. A whole group of diseases that are the results of vascular spasms could be caused by the deep breathing. Well, just 2 breath-ins, and the attack is starting. That's enough. Are you dizzy? Are there any spasms in your chest? Yes. If I listen to your chest now, I would hear wheezing. So you see, you've made 4 deep breaths, and the disease is now in evidence. And this is what is recommended and taught by the medicine. The whole world is being taught this. Well, I understand very clearly. This is how it works. Well, now we'll use my method, which means the opposite. We'll decrease his breath. Now he's holding his breath. Tell me now, how is it going? What is happening? The dizziness is going. Well, my method consists of 5 fingers, 5 basic points. 1, to decrease. 2, the depth of breathing. 3, by relaxation. 4, by diaphragm. 5, until a small deficit of air. Attention. One can use the Buteyko method only under a specialist supervision. In this hall, we conduct special breathing exercise, teaching the patients the ways of controlling and the prevention of bronchial and vascular spasms. We teach them theoretical and practical skills of normalisation and regulation of their breathing. We examine the clinical aspects. We observe how the patients gradually reduce the intake of medications. Most of the patients come to us using large doses of broncholytic and steroid preparations. Using the Buteyko method, the patients gradually reduce and even totally remove the need to depend on these drugs. We have a very large number of patients. The achieved results are very positive. Not only the improvement can be observed subjectively, it is proven to be there by objective investigations. These people who practically rose from their graves are our best allies. They will fight for our method. They are our army. By now, they are counted in the tens of thousands in the Soviet Union. So here, we're now involved in a struggle of principles and ideas. But the truth is on our side. we achieve a 100% effective result. This was proven in Leningrad with 46 asthmatic patients in 1968 and again in 1981, when the Ministry of Health of the USSR ordered another approbation to be conducted at the First Medical Institute's pediatric department. This time, my student and follower, Janina, was given 52 children, all of them in very grave conditions, like Ochelka here, who were so over-medicated they were half dead. The deep breathing changes the pH, the acidity-alkalinity balance of the organism. This disturbs the metabolism, and the disturbed, unbalanced metabolism turns the immune reactions into allergic ones. That makes the allergies also the result of the deep breathing: arthritis, obesity, malnourishment. As a result, the immunity is lowered. This is exactly what we're observing in our times. It follows, then, with the lowered immunity, colds and flus are developed easily. Even AIDS will attack those who breathe deeply much easier. The metabolic disturbances can be so immense that even tumors and cancer will appear. So even cancer can be the result of the deep breathing.